Okay, communication in nursing, we are already on chapter 7. Sundan niyo po ninyo ako, no? Page 132 na tayo. So, communication in nursing. Communication is a process in which people affect one another through exchange of information. Communication is a dialogue. May nagsasalita, may nakikinig, at merong nagre-respond. So that is communication. Communication can also be a monologue. Yung isa lang ang nagsasalita, wala kang hinihintay na response. But when we are talking about communication in nursing, we are communicating our thoughts, our feelings sa patient, and the patient is also communicating their thoughts to us. Nurses communicate with the patient to develop meaningful relationships. Yan. Communication is the key to the nurse-patient relationship and the ability to deliver patient-centered care. As a member of the health team, nurses need to communicate information about clients accurately, timely, and in an effective manner. Right. So, communication is the key. Dito na tayo sa levels of communication. Nabigyan na natin ng introduction kanina to. We have intrapersonal, we have interpersonal, we have small group communication, and we have public and electronic communication. Dito muna tayo sa interpersonal communication. What is interpersonal communication? Intrapersonal communication, intra means inside. So you are talking to yourself. Not necessarily naman na kapag ikaw ay kinakausap mo na yung sarili mo, something is wrong. So this is a positive self-talk na tinatawag natin. Intrapersonal communication is yung the nurse uses intrapersonal communication to develop self-awareness. Maaalala nyo yung discussion natin last week about self-awareness, self-evaluation, self-realization. For example, you have a very difficult patient. Meron kang pasyente na sobrang sungit at ayaw mo na sa'yo ma-assign yun. So every time na pupunta ka sa kwarto, so pupunta ka sa room ng patient na yun, kinakabahan ka. Lagi mong sinasabi sa sarili mo, naku, ito na naman yung patient na to. Baka kung ano-ano naman ang sabihin sa akin, ano naman ang mapansin sa akin. So you are belittling yourself. A positive self-talk is yung sasabihin mo na, this is a challenge for me and this is an opportunity for me to learn. Nakita nyo yung difference? Kanina, you are telling yourself, I cannot make it, this is too difficult, hindi ko to kaya, baka mapahiya ako, yun yung mga sinasabi mo sa iyong sarili, but you are turning those negative self-talk into a positive self-talk. Ito yung intrapersonal communication. A nurse is considered a nurse has the ability to introspection, yung introspection and reflection na tinatawag natin. This is a positive self-talk provides a mental rehearsal for difficult task or situation. For example, you have a very difficult recitation or a very difficult return demonstration. Do you find yourself na sinasabi mo, kaya ko to, kaya ko to, kaya ko to? Or baka lagi mong sinasabi, di ko to kaya, babagsak ako. So, self-talk, i-check mo ngayon. Do you have a positive intrapersonal communication with yourself? Do you have a positive self-talk? So, ikaw ang makakasagot niyan. Number 2, interpersonal communication. Interpersonal communication is one-on-one interaction between a nurse and another person that often occurs face-to-face. I am reading from page 134. Ito yung one-on-one interaction. For example, you are talking to your nurse manager. You're talking to your clinical instructor. Meron mga instructions. That is interpersonal communication. Small group communication naman, naalala nyo yung different fields of nursing. Meron tayong collaborative nursing effort. Meron tayong mga nurse leaders, team leaders. Yung small group communication, these are interactions that occur when a small group of people meet. Usually, these are, for example, you are meeting. I experienced dati, there are sa Pangasinan, merong bago mag-rounds ang mga doctors, mga nurses, merong mga certain na mga difficult cases na talagang pinag-aaralan ng lahat ng mga involved na mga doctors and nurses. Pinag-aaralan yung background ng patient, pinag-aaralan ng kanyang medications, pinag-aaralan ang kanyang improvement. So that is considered a small group communication. We also have public communication. This is your interaction with an audience. For example, you are napili, you are chosen to be a representative of your hospital to talk about this or that in a seminar. That is a public communication. Electronic communication, simply you are using technology. You are conveying your message through the use of technology. So that is that. Okay. Let us turn to page 135, modes or forms of communication. We have verbal and we have nonverbal. Kung maalala po ninyo, no, sinabi ko, when we are sending an email, you have to practice na, as early as today, practice muna that you are sending an email with a subject, with a file name, that you are sending an email with a body, and with an attachment. Do not forget, baka nilagay mo doon, ma'am, this is my recitation, and here is my attachment, attached file, pero wala namang naka-attach, nakakalimutan. So you have to be very careful with that because communication is spoken and also written. So na-exercise natin ang ating professionalism sa mga communication natin. We also have nonverbal communication. Dito na po papasok yung gesture. Baka meron kang kausap, laging nakahulikip-kip or kaya laging nakasandal sa kanyang seat. Yung makikita mo kasi if a person is interested kapag meron kang kausap at hindi siya, tingin siya ng tingin sa oras niya, tingin siya ng tingin sa watch niya, sa orasan niya, ibig sabihin, that person is not interested or that person may be telling you something na gusto na niyang umalis. So those are body movements na ko-convey natin ng ating conversation. Okay? For example, ano pa ba? For example, with nonverbal communication, your physical appearance, yan, yung body language natin, eye contact, and tone of voice. Let us move on with important aspects of verbal communication. Magre-review na lang tayo dito. You need to check your vocabulary. For example, when we are talking, nakikipag-usap tayo sa patient natin, kung hindi niya maintindihan ang blood glucose, sabihin mo na lang blood sugar. Do you get me? That you are conveying your message in a manner na maiintindihan ng iyong pasyente. Not necessarily na ibabasahin mo pa sa kanya, ma'am, ang bilirubin po kasi, ang ganito po ang platelet. Hindi naman niya naiintindihan. We have to convey our message in a way na magiging simple pero klaro. Denotative and connotative meaning, may mga words, may mga salita na iba ang dating sa ibang culture, sa ibang upbringing, sa ibang mga background, sa words na ginagamit natin. Okay? Pacing, yung bilis ng pagsasalita. Maybe you are too quick, too fast to talk, hindi na ikaw naiintindihan. Intonation, yung taas ng boses o yung baba ng boses. The clarity and brevity. Clarity, clear ba yung message na ibinigay mo? Brevity is yung how brief your statement is. Diba? Wala namang mahabang brief. Brief is short. You're keeping your message short and sweet. Timing and relevance. For example, for a patient na talagang sakit, sobrang sakit na ng tiyan niya at gusto na niyang, or for example, a patient na nag-rupture na ang kanyang ruptured appendix. Diba? For appendectomy na namimilipit na siya sa sakit. Hindi yun yung timing hindi yun yung time para interviewin mo siya na, ma'am, ano po yung huli niyo pong kinain? Ano po yung mga ganyan? Kasi for operation na siya, for emergency procedure na siya. That is not the time para magkaroon pa tayo ng physical assessment or yung ginagawa natin. So may mga timing and relevance. Timing is everything, mga kapatid. Different aspects of nonverbal communication. We have personal appearance, your posture, your facial expression, your eye contact, your gesture, your sound, territoriality, and personal space. Mapapag-uralan natin dito yung personal space. Go with me sa page 139. For example, ng intimate zone. Yung intimate zone, 0 to 18 inches. For example, you're holding an infant, you're holding a baby. Siyempre, ang paghawak mo naman sa baby, malapit sa iyong katawan, sa iyong dibdib, hindi mo naman pwede siyang hawakan ng malayo, no? Kasi you are taking care of your baby. Intimate, taking care of the baby, taking care of the child. So that is intimate zone. How about personal space? Yung personal space naman, that is 18 inches to 4 feet. You are sitting, examples, you are sitting at a client's bedside. You're taking the client's nursing history. Siyempre, medyo malapit ka. 18 inches to 4 feet. How about social zone? Yung social zone naman, for example, you are with the physician, you are with the doctor, and you are making rounds. Bumibisita kayo sa bawat kwarto. That is social zone. Dahil hindi ka naman face-to-face na nag-i-interview sa patients or sa client. That is social zone. Public zone is like you are lecturing. Parang ginagawa ko ngayon, we are public zone. We are not only 12 feet away, pero ang layo natin, this is public zone. Okay. Binibilisan ko na, tapos mamaya meron tayong discussion na, ayan. Zone of touch, meron tayong personal space, meron ding personal touch. Social zone, these are zones na hindi mo na kailangan ng permission. For example, you will hahawakan mo ang kanyang balikat, ang kanyang likod para alalayan, hindi ka na kailangan ng permission. But yung consent zone na tinatawag, zone of touch, you need to ask for permission. For example, hahawakan mo ang kanyang bibig. Siyempre, medyo na yan, sensitive na. Meron kang ilalagay mo na, for example, the patient is unable to take the medication, the oral meds on her own, at tutulungan mo siya na iti-take niya yung oral meds niya. Ma'am, ilalagay ko na po tutulungan ko na po kayong uminom. So, those zone, hihingi na tayo ng permission. For example naman, next naman, yung vulnerable zone. For example, the face, the neck, the front of the body. For example, ma'am, i-check ko po ang inyong heart sounds, diba? Ilalagay ko po ang stethoscope dito or dito po. Medyo intimate na siya. Example, you are putting or removing a Foley catheter, diba? Or you are putting on a suppository, intimate zone na yon. You need special care and you need permission. Okay? And that is vulnerable and intimate zone. So you need to ask for permission and there is a great sensitivity. You're putting, so yun. Those are the zone of touch. Social zone, consent zone, vulnerable zone, and intimate zone. We need to know yung personal space natin. Yung personal space natin as a nurse and yung personal space din ng binibigyan natin ng pag-aalaga. We do not need to invade the privacy of a person. Kung, for example, may client na mag-a-ask sa'yo, nurse, pwede po ba, wag niyo na pong, for example, stable naman ang kanyang vital signs. Nurse, pwede po ba na matutulog muna po ako kasi ang binigay sa kanyang order ay every 15 minutes, chinecheck ang kanyang vital signs. Pero dahil nakita naman na stable, magre-request siya na pwede po ba for the next hour, wag muna at gusto ko pong matulog ng tuloy-tuloy. Merong mga instances na gano'n. Okay? So, let us go on with characteristics of communication. Communication, number 1, is simple. It includes commonly understood words. Madaling intindihin. Kung pwedeng itagalog na natin. Yan. Clarity involves saying exactly what is meant. Mahirap yung kausap na hindi mo maintindihan. at yung gusto pala niyang i-convey na message ay iba pala sa naiintindihan mo. So it is very hard. Especially, dito po papasok yung clarity, no? Dito papasok yung, for example, yung patient mo, yung kliyente mo ay child, bata. Hindi niya yung understanding niya ay very minimal pa compared sa kung adult ang iyong kausap. Tama? So you have to use words na kayang maintindihan ng isang 7-year-old, ng isang 10 years old, or pwedeng gagamitin mo yung language na maiintindihan ng client mo or ng patient mo. For example, ang client mo ay Gen Z. Ang mga language na ay medyo techy. So you need to upgrade yourself or magle-level ka doon sa level na kayang intindihin ng iyong client, ng patient, no? Adaptability, next. Timing and relevance. This requires choice of appropriate time and consideration of the client's interest and concern. Ask one question at a time. Huwag sunod-sunod na hindi na niya naintindihan at masyado na siyang na-stress sa mga tanong. Wait for an answer before making another comment. For example, ma'am, ano po yung huli niyo pong kinain? Ma'am, ano po yung anong oras po kayo huling dumumi? Ma'am, anong oras po? Hindi pa niya naiisip kung medyo tuliro pa siya. Iniisip pa niya, ano ba yung huli kong kinain? Anong oras? Tapos ang dami mo ng follow-up questions, mahihirapan. Adaptability involves adjustment on what the nurse says and how it is said depending on mood and behavior of the client. Maybe that time is not the best time to give information. I-check din natin. Credibility means you are worthy, means worthiness of belief. To become credible, the nurse requires adequate knowledge about the topic being discussed. May credibility, ibig sabihin, meron kang expertise, you are knowledgeable, and you are skillful. Okay? Okay, hinga lang ako. 1, 2, 3. Punta na tayo sa page 141. Okay. Sa page 141, ano ang nakikita ninyo dyan? Sige, punta kayo sa page 141. What can you see? May kausap pa po ba ako? Yan. Sige, anong nakikita nyo sa page 141?
Circular transactional model of communication.
Circular transactional model of communication. So itong diagram na to, ang explanation nito, thank you, Andrea, that this is a diagram, circular transactional model of communication. Ang ibig sabihin niyan, this is the message. You are sending a message, may sender, merong receiver. Yung referent, ang ibig sabihin niyan, ito yung mga pagkakataon or yung mga situations na makikita mo, ito na yung best time para sabihin sa kausap ko. May mga ganun eh. For example, this is the best time para sabihin ko na sa kapatid ko or sa tatay ko. Yung mga signal, mga sign. Channel is how you say, channel is how you deliver the message. Pwedeng through email, pwedeng through text message, pwedeng you will call that person. So this is the circular transactional model of communication. Ang makikita nyo dito na mahalaga, sender, there is the message, there is the receiver, plus after ng receiver, merong feedback. Mahalaga na i-convey mo yung message na at makikita mo din, am I being understood? Nagsalita ako na nagsalita, naintindihan kaya nila ako. So yun yung essence ng feedback. And ito namang interpersonal variables. Bakit siya broken line? Kung maalala nyo, no, yung marami tayong may encounter na mga ganito, ang tawag ito framework or yung diagram. Bakit siya dotted line? Dahil yung interpersonal variables pwedeng magkakaiba tayo ng beliefs, magkakaiba ng social status, magkakaiba ng educational level, kaya magdidepende yung pagko-convey mo ng message, depende kung ano yung upbringing ng isang tao. Yan. Do you get me? So, yun. So, ito yung circular transactional model of communication. Merong sender, merong receiver, merong message. Siyempre, nasa gitna yung message kasi yun yung pinakamahalaga eh. Kaya merong model na ganito because of the message. Ngayon, how will you send the message? Merong channel. How will you know na pwede mo nang sabihin yung mensahe mo, ito yung referent na tinatawag or yung mga signal. Maganda ba yung mood ni mama para sabihin kung may babayaran kami? Parang gano'n. O kaya maganda kaya yung mood ni tatay para sabihin kung gusto ko ng bagong ganito. Alam nyo, yun yung mga referent na tinatawag. Okay? Referent motivates one person to communicate with another. Ito yung cues, mga signal mo na pwede mo nang sabihin. Yun yung tawag doon, referent. Okay? Elements of professional communication. You have courtesy. Okay. Yung courtesy, ikaw ay magalang. Ikaw ay you respect the person, you respect the patient or the client, regardless of the age, regardless of the social status, mayaman man o mahirap, or anak man ng presidente or hindi, you are being courteous of the care that you are giving that person. Dito naman, yung use of name, yan. If you can read sa page 143, nakalagay dito, no? Always introduce your self-name and your status. For example, yung lagi nating ginagawa sa inyong return demo, no? Ma'am, sir, my name is Roma Amor Feliciano and I am a student nurse at Wesleyan University, Philippines. You are introducing yourself. And always address people by name. Nakalagay dito, use proper titles of respect as Mr. For example, hindi mo alam kung hindi mo siya kilala if that person pala ay isang engineer, isang person pala, isang doktor, yung client mo. You will address that person in a general manner na lang. Mr., Mrs., or Miss. Okay? Avoid terms of endearment. Yan. Iiwasan natin yung, ay mami, ay daddy, ay lolo, ay tita, or although sa culture natin, tayo kasi medyo, yung culture natin parang medyo malambing ang mga Pilipino na, ay si baby, may ganyan, meron tayong ginagawa ng mga terms of endearment. But professionally and ideally, mas maganda, we will consider or we will address the names of our client, of our patients in their with their proper names. In other cultures, for example, tayo ay nagtrabaho sa ibang bansa or ibang culture, sa kanila, mas gusto nila ang tawag ay last name. So for example, De Los Santos, si Miss De Los Santos, si Miss Parungaw, Miss Barrientos, Miss Cabatuando, gusto nila yung last name. But some cultures naman, offensive naman sa kanila na kapag tinawag mo sila sa first name naman. Very offensive naman kasi feeling nila, bakit close na ba tayo para tawagin mo ako sa first name ko, first name basis. So something like that. Okay? Move tayo sa okay. This technique, the Edet or the Edet, this technique is developed to enable healthcare workers to provide accurate and timely communication. This is acknowledge, introduce, duration, explain, and thank you. Acknowledge, ito yung ginagawa mo na, ma'am, my name is blah, 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 and I am a student at ganyan. You are introducing your procedure, you're introducing what you are going to do. And sasabihin mo, this will take 10 minutes po, or this will only take 2 minutes. That is the duration. You will explain possible side effects plus possible consequences, possible na i-expect ng isang patient, okay? And you will say thank you. So that is Edet or the Edet. Okay, guidelines for active and effective listening. Sit facing the client, observe an open posture, lean towards the client, establish and maintain eye contact. Yan. So meron pa tayo, binibigyan pa tayo ng mga guidelines for active and effective listening. Guidelines for use of touch, na bigyan na natin siya kanina na explanation. And some guidelines lang. For example, developmental considerations in communication. Number 1, older adults have communication needs. Ang iba sa mga client natin, if they are already senior citizens, meron na mga hearing aids. Or meron naman na as young as they are already using their hearing aids, and we have to be very considerate and very careful. Okay? Are we, paano natin kakausapin ng isang infant? Di naman natin siya makakausap. So, ang kakausapin natin ay ang nanay, ang guardian. Toddlers, school age, and adolescents, different age groups, different communication strategies. Okay. So here, yung considerations in adults, these are self-explanatory. Babasahin nyo na lang po yan na page 146 and page 147. Ito yung kapag ikaw ay kumakausap na ng mga older patients. Okay? Punta tayo sa mag-jump tayo dito sa okay. Communicating with clients with special needs. I am on page 148. There are patients who are needing our care who are they are clients with special needs. They are physically challenged, cognitively impaired, unresponsive, aggressive, hearing impaired, visually impaired, or may times na hindi sila nakapag-aral, no read, no write, who do not speak English or Tagalog. Yan. What are we going to do? There are communication aids. There are times na, lakihan natin. Yan. Pwede kang gumamit ng board, yung, dito, whiteboard. Pwede kang gumamit ng whiteboard, pwede kang gumamit ng cellphone, pwede gumamit ng sign language, pwede gumamit ng yung pain level, pwede kang merong ipapakita na picture na yung pain scale na tinatawag for the for the toddlers or for the children. Ipapakita mo kapag nakangiwi, pag naka-frown, ibig sabihin yung pain level niya ay mataas. At kapag naman siya ay medyo naka-smile pa, sabihin yung pain level niya ay medyo tolerable. So those are communication aids. Okay. Let us move on with communication techniques. But before we move on sa communication techniques, break tayo ng 10 minutes and then balik tayo agad para matapos natin itong communication techniques. Okay? My time here is 3:59. So balik tayo na 4:10. Yan, saktuhin na natin ng 4:10. Okay? Thank you guys.